And also announcing today another $6 million in emergency funding to help the Alberta government deal with the opioid crisis. This money is on top of the $75 million in federal funding previously announced to address the ongoing crisis. In 2016, 343 people in Alberta died from fentanyl overdoses alone. For more on this announcement and what it means for our province, we've reached addiction specialist Dr. Hakik Virani in Edmonton via Skype. Hi, Dr. Virani.
Hi, Carolyn.
So why don't we start with just your reaction to this funding announcement?
Yeah, it's good news. I mean, obviously, more financial resources are better than fewer financial resources. Now it's a matter of how quickly and effectively can Alberta use those resources to impact this overdose epidemic.
Well, not to look a gift horse in the mouth here, but the federal government has already committed $75 million in funding for this issue. So just how useful will an extra $6 million be?
Well, it depends on how we decide to use it. I mean, the federal funding for a change in the federal drugs and substances strategy, I think, is useful to move us towards a more scientific approach that includes harm reduction services, and then a special allocation for British Columbia and one now for Alberta, who are experiencing really quite frightening proportions of opiate overdose death. So I think that if we decide to use these funds in an evidence-based fashion, then they can be impactful.
So if you had the checkbook in front of you, where could this money go?
Well, I think that an expansion in harm reduction services is critical to serve an important part of our population who's at risk of opiate overdose death. We know that in Alberta there's a desire to open safe drug consumption services in Edmonton before the end of the calendar year. We need those services in multiple places in Alberta, and I think some of this money could be used in that fashion. We certainly need improvements in access to medication-assisted therapy for people who are struggling with opioid use disorder, and for ancillary psychiatric and mental health supports for patients who have addiction but also have co-occurring mental health conditions that contribute to their substance use disorder. And I think that, as we've learned from where people present in the days and weeks preceding a fatal overdose, there are a number of touch points in our healthcare system where strengthening linkages between those places, like emergency departments and walk-in clinics and pharmacies, to evidence-based treatment for people who are struggling with opioid addiction could go a long way to stemming the tide of opiate overdose death. So those are some places where we could see immediate impacts in terms of reducing the risk of opioid overdose death. And I think that there are some other places where we could spend that money too, in terms of conducting better surveillance to characterize this problem, more so than just how many people are dying from fentanyl overdoses. But what does the picture of drug poisoning look like in Alberta, from trends in drug use to trends in drug-related harms?
Okay, just quickly, we have been talking about fentanyl and its harms for a couple of years now. The number of deaths just keep rising, though. So are we as a province getting any closer to finding a solution to this crisis?
But I think it's important to know that there are solutions at hand, right? They're the ones that we've talked about. The problem is that they're not being executed as fast and as widespread as they need to be. I have a colleague who admitted a patient to treatment today who named 12 of her friends who have died from opiate overdose in the preceding 2 or 3 years. So, I mean, clearly with stories like that and with numbers that demonstrate that in the last quarter of 2016, we were losing one person every 18 or 19 hours in this province to fentanyl poisoning alone, it doesn't demonstrate that we've got a great handle on this problem. I hope that this additional resource from the federal government will assist us in getting there. But I think it also is important to note that there are other things besides providing financial resources that the federal government can do to make an impact in this problem. And one of them is pursuing decriminalization of illicit drug use, which I think many public health experts would endorse as one of the most important strategies to addressing this problem.
Okay, Dr. Hakik Virani, joining us from Edmonton tonight. We very much appreciate your time and your perspective on this.
Sure thing, Caroline.
An offer by TransCanada